So I'll now invite all the speakers to join the forum. Shankar sir, Satish, if you can put all the speakers so that any questions which need more elaborate answers could be answered. So Ashish, this could be a debate also, but yes, we support this, that the penetration of internet will be instrumental. There are already many apps that we have in our mobiles. We bought that you know wearables also, and then it is connected to an app in your mobile, and it is tracking your heart, and other things are coming up in this space. So very relevant to today's professional this would be. What are your thoughts, Shankar sir, Vasan sir, Vivek sir, on this?
Yes, Shankar, you answer first. Go ahead.
I think we are really into a very, very interesting time frame or context, and I feel blessed that at least within our lifetime, we will see that how this transformation is happening. And that's why this year's theme of how do we get equipped for the tool, managing the tool of artificial intelligence. I am again and again emphasizing that ultimately it is the human mind which has to use the tool, and it is AI or the digital therapeutics which Archie has just talked about. They are not going to replace what a human creative mind can actually intervene and change. And we are going to witness this maybe within the next few years' time. And so it is going to be an exciting time. And I am aware of interesting thing happening in the chronic segment area, especially in diabetes, like Mr. Joshi talked about, as well as in cardiovascular. I have just a week ago, I heard about the way arrhythmias is going to be monitored with the ambulatory patches. Okay, and it is a very evolved segment, no market in US, but it has just entered into India. So how these changes are going to play an important role in the patient's life, okay, making their quality of life much more better than what it was in the earlier days. I think their the presentation by Joshi has given an interesting opening for us to take it forward. That's the way I would like to comment. And if any other questions are there, I would like to take it.
Thank you, Shankar. So, Vasan sir, would you like to speak something on digital therapeutics and its?
Oh yeah, I think
Yeah.
it's going to be interesting because the doctor is going to be supported with a lot of other information with respect to the patient, a lot of stuff patient doing themselves with respect to how they have progressed post the visit to the doctor. So earlier, it was like you go and meet a doctor, he gives you certain medicine, and then he asks you to follow certain things, and he didn't know how well you have done in between, and then he meets you in the next visit. So how much you're complied, not complied, that was always the black box. So you were deciding drugs based on, okay, I think whatever I given, he would have done his best to comply, and then maybe this worked, this didn't work, then I'm going to change my medicine accordingly. Whereas now I think there's going to be this consistent and continuous monitoring, because of which there could be pressure on the patient also to comply more perhaps, and the doctor's choice is going to be far more precise and with a lot of more information and knowledge than what he was doing before. So this opens up a plethora of opportunities. Means I think Mr. Joshi has beautifully captured how things are changing on the diagnostic space, and he was asking the students to take a look at the other opportunities that is going to come in our way in terms of jobs and in terms of career, what we can make. But having said all that, in terms of information that is going to be there on the doctor's table, the sort of analysis, complex analysis, what one can get into, or what looked very complex can look very simple because of artificial intelligence, and that will provide a lot of lead. But finally, I'm maybe belonging to the same school of thought like my colleague Shankar Das, where ultimately the decision making has to be made by the doctor, because the human intervention, what we say, like see what AI does, whatever I know, is it generates an algorithm. It says that, okay, this is the pattern what people have followed. If these are the issues, if these are the complications, this is how it has been treated by most majority. So you will get something, say 95 to 98% right. But medical science is not about getting the majority right. The medical science is also getting about the odd ones, the ones which don't fit into a specific case. See, diagnosis is always like a mathematical equation. You see a picture, you have got numbers, numerical values, and you see the patient, and then you make sense of okay, all of this, and say this should be the diagnosis. It should be sharp, it should be precise. You can't leave anything hanging. But when it comes to how somebody is going to be treated and how they are going to react to a specific drug, the same regimen, same condition, people react differently. So then how are you going to manage? How are you going to quickly change? How are you going to adapt? How are you going to manage the side effects which has thrown up some values going out of order? So those critical cases, how do you manage? There, I think the doctor's intervention is going to come in, and it is going to matter. So for a good doctor, he gets actually a lot of support now through AI. But however, the human element in terms of decision making and how is he going to take it forward, I wouldn't say that he can leave it to the machine to take a call.
Thank you, Vasan sir, for your views. And I'll take up one question, which is again regarding digital and all. What do you think in today's digital marketing age, print brand reminder are more effective, or the digital ones sent through WhatsApp broadcast group to doctors? So what are your thoughts? Deepal, I'd ask you to please take this up. What do you think in today's digital marketing age, print brand reminder are more effective, or digital one sent through WhatsApp broadcast group to doctors? Unmute, please unmute.
I think both of them have their own roles to play. It is not like either a digital would fetch you more eyeballs or the print would fetch you more eyeballs. It depends on the factor of the doctor also being that savvy to take that up in terms of looking at it and at what time point. For example, if I am, amidst so many patients, and if there is a print literature lying there, I may not even have the time to look at it. But if I'm traveling and if I get some message on my phone and I'm free enough to look at it, that point of time, that literature or digital input would have more impact on me. So I think it has both the things. Print also has its own importance, so we should not be losing out that we will go only behind a digital input and not go to print. We will have to balance out both. Yes, more important is what sort of communication do we do on that. Maybe at either literature, print literature will have more space and provision for us to put in more information, and digital may have its own ways to put in information in a bite-sized format, but more gamified or digitized format. So the reciprocation of both of them will be different. So I think we will have to kind of take and create a balance between both.
Any other take, sir? Yeah, Shankar sir.
Can I add a comment? Because it's a very interesting question. First thing is, since WhatsApp has come, I must share my personal experience. First thing is, whether it is hard copy or WhatsApp or digital medium, content is the king. That's what I would like to say. My personal experience is that if a brand manager or a marketing team perceives that what you see physically in a literature or a visual aid, the same content, I will push it because I have 100 doctors' mobile number with me and WhatsApp number with me, then it would be a disaster in the sense that it will never even get opened. Okay, in my experience, I have seen, and there is a very famous key opinion leader in pediatric dermatology, Dr. Sandeep Bandar, whom we leveraged his time and efforts in educating only through WhatsApp video calls. It happened during COVID time. Close to about 1,700 pediatricians in the country, we could engage them in about 30 minutes or 45 minutes of WhatsApp engagement with Dr. Sandeep Bandar. Okay, and it was not about Atogla or Teddy Bear. It was more about how do we treat the atopic dermatitis patients. Do you think the benefits of this such a session will go to some other brand? I don't think so. If you don't put our brand name and push that literature in the WhatsApp, okay, I don't think it is going to come because of that putting brand name, but it is because who did it and what is the content. That's my experience, and I do believe that WhatsApp is an important digital tool if content is the king. That's how I would like to comment.
So I just want to add one point.
Sure,
So,
please do that.
yeah. So what's happening today, see, the disconnect happens because, traditionally we have used print, and after digital coming, correct, we are not innovating or experimenting or disrupting with digital. We are using the same print ideology and thought process while using digital. So 90% of the digital input, what has happened, the LBL which was there in the print form, that has gone to a digital form, and through omni channels, through mailers, through WhatsApp, through messages, and through the iPads, the same thing is going over there. In fact, this medium has a potential to interact. Now, problem is that this interactive high potential medium is not talking to the customer. It is doing the same LBL wala job. So that is creating a disconnect over there. And what happened because of COVID has increased the distance. Correct. Now they have iPad only. iPad is 10-inch. And LBL, which is there, which is almost, A4 size, which is twice bigger than that. Now, when people were earlier using LBLs, the distance was also less. They were able to show it well. But after COVID, the distance between rep and the doctor is almost 3 times more. They meet him with a much higher distance. So now what is happening, that even small digital inputs which they show on the iPads, the doctors are not able to see anything beyond brand name into that. And slowly the teams and the doctors are losing interest into that. Exception, there are few agencies and few companies are using digital through some gimmicks, interactives, and some storification of that, which is multiplying the impact of their messages. Wherever it is not used, it is failing. And I have seen many companies even coming back to the LBLs in a much bigger way, because that is big. At least, that what Gauri said, before you throwing it, you will able to see at least once, at least that will be there. So that's happening in the market.
Yeah, Dr. Swati, just a quick point from my side. Wouldn't
Yes,
take much time. See, what I find is if you want to demonstrate a mode of action or something in greater detail, then your video digital is better. Whereas if you are going to quickly go through the brand names as reminders, then your for the reasons what Mr. Joshi said, because of the size and the display, a typical visual aid is better. But coming to printed leave behind literature, see now we are doing this in the honor of Dr. Tarun Gupta. In fact, he hated leave behind literature because he wanted the reps to go on detail. So that became as a cool substitute for people who are not able to use their detail aid very effectively. You just go and tell the doctor, here is a piece of information wherein you can get everything about my product. So kindly go through it. Neither he has opened and seen what is there in that literature to explain those graphs and other data there. So that is a poor substitute, according to me. So
I
it
just
is a
add a
visual
few
aid
points.
or a detail aid, a digital detail aid. So this LBL, I would say that you use it, but make your rep understand what is there inside, not just leave it behind.